When your systems are down, it's very frustrating. Does this affect emergency services? This is a question from Daniel Komen.
Thank you, Mr. Komen. It is true that time systems may be down.
Yes.
And I think that happens to any system.
So
even sometimes
Kenya
Power goes off. But of course, it's not an excuse. And that's why we have been working on upgrading our system to ensure that they are always up and running.
Yes.
However, on the question of emergency care, actually that's a requirement and it's a guideline given by the Ministry of Health. Nobody should ever deny care because I cannot identify myself. Because I would ask, if somebody was knocked down by a car here on the street, and they go to the hospital, they cannot talk, they cannot even be able to say their names. You'll not start saying, I want to know whether you are an NHIF member first before I treat you.
Yes.
On emergency treatment, you are supposed to give care first, then confirm other details later. So nobody should be denied emergency care because the systems are down. They should be treated first, then the other details can be confirmed later. And that is why we also have, NHIF also have a toll-free number you can call so that if the systems are down in the hospital, the hospitals actually know how to communicate with us because every hospital is at our branch office. And every branch office, they have the contact person. The hospital will be able to call and say, a patient by the name Dr. Kingori has come here, and the systems are down, we are not able to confirm, and can you be able to confirm for us? But if it is emergency, by the time, even before they call, Dr. Kingori should have been treated.
A patient by the name Doctor. Sawa sawa. Kuna wengine bado, I think someone needs to, Rachel Akweu. First, there's a gentleman hapa, anaitwa Timothy Nyarera on Gubo. Anasema wanatutesa sisi wazee, retirees. It is as if getting NHIF insurance is a favor. Is there an age limit for NHIF?
Thank you for that question. Actually, NHIF has no age limit. It is the only insurance that has no age limit.
Okay.
Anyone can join. And actually, I remember there's a time there was an article in the media where there was a 120-year-old man who wanted to enroll with NHIF. And actually, they were asking, can I enroll? And actually, we were able to enroll that person. There's no age limit for the retirees. Actually, what we advise people who are retiring from work is that immediately you retire and you get your last salary, immediately the following month, start paying for yourself the 500 shillings per month. What is happening currently is that actually there are some laws that have been enacted in the country that now they are creating what we call post-retirement medical cover, such that you can contribute, Dr. Kingori, when you are still working, so that when you retire, you don't have to contribute and you are covered. But even those ones who have already retired before those arrangements are there, they simply need to continue contributing the 500 shillings per month, and they'll continue enjoying benefits. And actually, some institutions who handle retirement benefits are already enrolling the retirees under them as a group, so that this retiree is not bothered. The officials of those retirement benefit schemes are making the contributions for them to NHIF, and they can enjoy the cover in their old age.
Asante sana. And Frank Ngugi is asking a question that I believe will go very well with upcoming cheaters in relationships. And also, can I enroll my second wife?
Yes, I would say yes, you can enroll your second wife. I'll explain. Dr. Kingori is shocked. Yes, you can enroll your second wife. Yes. However, the provision that is there in NHIF, even under this, you can enroll one spouse under you in your card. So Dr. Kingori is the contributor. He has put the spouse, and the children are going to be covered. Now, if you want the second spouse to be enrolled, then you actually apply for another cover for this wife. So you'll be contributing for them as a separate cover, but you are the person making the contributions. So they'll be able to have a card with their name, and you have covered the other spouse, the first one, under your cover.
Good luck agreeing with your two wives who will be out of your card. And then, Langat Martin, I think he's expecting a baby, I think, and also it covers ultrasound. That goes to the areas that you said NHIF covers.
Yeah, the benefits that NHIF covers.
Yes.
I'll be able to take the Kenyans through the benefits that we cover. We actually cover 10 benefits.